Okay, so I'm going to be doing an assessment today on my patient here who has COPD. So I've gathered a health history on him, and he stated that he is an 87-year-old man who has smoked for about 60 years, 1 to 2 packs of cigarettes a day. He gets very tired upon exercising, and whenever he does, he gets very short of breath. He wheezes all the time. He coughs. It's a very productive cough. He does spit up sputum sometimes whenever he coughs. He lives alone now. His wife passed away a couple years back, so that is kind of the health history I have. He has no previous surgeries or anything. He does what he is retired coal miner though, so he did work in the coal mine. He also was a veteran, so he has that history as well. And he was whenever he was a veteran, he was at war in Vietnam, he states. So that just gave us a little bit of history there. So I think due to the environmental job that he has had and the smoking history, that he could be a candidate for COPD. So I'm just going to do a little bit more thorough physical assessment. I checked his skin turgor, and it went back very well, so I don't see any problems with dehydration or anything there. His skin was very elastic. And doing my head-to-toe assessment, his skin appeared very dry, intact. I don't see any wounds or anything across his abdomen area or anything like that. It was very symmetric, but I did notice that his abdomen and chest, it kind of had like a barrel-shaped. It was very symmetrical, but it did present with a barrel-shaped. Sometimes COPD patients have this due to their lungs expanding more and having to breathe in like this all the time, and their diaphragm just expands out, giving it the barrel-shaped. So I'm just going to do a quick assessment here. His nails appear to be kind of tarry, and whenever I do the capillary refill, it's a slightly more than 3-second refill, so that could be something. And I did have him do the whole the clubbing with his fingers, and he did present with a little bit of clubbing as well, so that could be another sign there of COPD. So I'm just going to listen to his lungs here. We'll check his front first. Just breathe in deep for me. Okay, I'm going to switch you around here, your back. Okay. Okay. Okay, and all the lungs, upon osculating, all the regions, the upper and lower quadrants, all four of the quadrants on both the right and the left lungs, I could hear some crackles and wheezing in the lungs, so I could see definitely how he could be some short of breath there. He said that he did have some problem with bronchitis. He does get sick a lot, has some bronchitis history, and he thought he might have asthma, but he wasn't too sure, so he didn't really ever go to the doctor. He just dealt with the cough. So I'm just going to check out his heart here and listen to it and see if I can locate his point of maximal impulse. Okay, just listen to your okay, that's good. Your aortic, onymic, tricuspid, mitral, and your S1 and S2. Okay, great. All of his heart sounds good. I don't hear any murmurs. His S1 and S2, there was a nice lub dub, so that's good. I don't hear any abnormalities there. It was very nice, the big strong lub dub. Just check his pulses here. Okay. Alright, and you just need to check his brachial and radial, femoral, and you could do your popliteals, your posterior tibias, your dorsal pediis, and your femorals. And then upon inspecting his abdomen, like I said, I'm just going to osculate the bowel sounds really quick and do a light palpitation. Okay? Okay, and his bowel sound, everything seemed normal, and I did not hear anything with palpitations, or he did not seem like he was in any pain. That's great.